So the way you can test this exercise to see if it's going to be helpful for you is that you pop your ankle just above your knee and let your knee just drop. What it often does, it makes the pelvis drop this way too. So then just level your pelvis up, so your pelvis is level here, but let the leg drop. Then you just notice how high that knee is from the ground. So you can measure in amount of hands, just eyeball it that way, and notice how it feels. So it can feel quite different side to side. So it might feel like sometimes there's like a line of tension in the joint, sometimes around here, sometimes it's tense here, sometimes the groin. So it's a test of the joint capsule, plus any muscles that are tight and holding things a certain way. Then do the other side. And you're definitely noticing if there's pain when you do it too. So I'm just leveling out the pelvis to start, drop the knee down. So I feel like I'm a lot higher this side. So I'm just eyeballing that one for hand heights. So you just notice how it feels, what happens. And then we do this exercise for 4 sets and then retest. So how I set this up, you need to be near a wall, near a foam roller. This one's pretty long, it can be a shorter one, it still works. Pop that underneath that leg and pressing that knee is going to press into the foam roller. So it gets the adductor working as you get the glute working. So it's really good for stability through the pelvis. So I want my knee to be in line with my hip. So if I was here, I don't want that alignment. It'll do some stuff, but this is where we want to be to start with. So there's that alignment there first. This leg has to be up, of course, so that so the foam roller can be there. I'm comfortable with my spine, so you may need a pillow under your head. That's all fine to do. The further in my heel is to my backside, the more it gets my glute to engage. The further out the foot goes, the more the hamstring will engage too. So I recommend having the foot in close to your backside to start with. And then, like all bridges, it starts off with the pelvis tucking under that way. So pelvis going under that way. Then I'm peeling my spine off the floor like my body's Velcro. So I'm peeling that off. And then I go back down one vertebra at a time, like I'm carefully sticking the Velcro back down. So I've got some push going in here. I push through my foot, get the curl through the body, and I lift up as high as I can, and it may not feel like much movement. And then I'm carefully coming back down one vertebra at a time. And then I'll practice that again. So I tuck the pelvis under, constantly squeezing into the foam roller. You may, in the beginning, notice you use your elbows quite a bit. Gradually, you want to have no elbow use. You can have your legs straight if that's easier. And it'll burn your butt, it'll burn the adductor. You may shake because it's an unusual, unaccustomed movement. It's all fine to do. It'll strengthen and stabilize the pelvis like crazy. As I push through my foot, I'm aiming to push through on this side, the center of my heel, knuckle of the big toe, knuckle of the little toe. So that tripod, I'm pushing through that tripod, and that actually influences through reflexes what's happening with this hip as well. So starting off with 5 to 10 reps, 4 to 5 sets. And this can be done daily, but every second day is okay as well, and definitely do both sides.